after the 27-hour markup that we had in Energy and Commerce, I called my children, one of whom just graduated from college and the other one who's in medical school, and I told them I never even pulled an all-nighter in college. I don't know why I'm starting now. But I'm very grateful to be here today to talk to you about where we go next. Moments after last Friday's spiking of the ill-conceived bill that would have dismantled the Affordable Care Act, of course, the inevitable reckoning of winners and losers started. And the winners and losers part, that's a natural thing to be talking about, but it's not the whole story. I think that the biggest winners were the American public, who called and emailed their members of Congress in record numbers, who spoke out passionately at public events like the town hall meeting and the rally and the listening session that I had. And they told their stories about how the Affordable Care Act has really changed their lives for the better. And more than any other force, the activism and passion of the American public has really what's turned this debate around. Americans don't think that the ACA is perfect, and certainly after last week, nobody's still saying that. But what they did say is they think that Congress needs to mend the ACA, not end it. And they're not alone. I've been a longtime proponent of bipartisan improvements to the bill, including at every hearing that we've had in my committee, the Energy and Commerce Committee, where I said, you know, if you Republicans would give up this idea of repealing the Affordable Care Act and work with us to improve it, we could make a lot of progress. But as challenges to implementation of the act arose, there was really, frankly, no conversation in Congress and no bipartisan conversation among the public about how to come together to address the very real issues that we had with the Affordable Care Act. Sadly, since in the 7 years since the ACA was passed, we heard nothing in public from the Republicans except for repeal and later repeal and replace. But privately, over the years, particularly since the passage of 21st Century Cures last year, a number of Republicans have approached me and other Democrats to talk about ideas about how to improve the ACA. This especially happened last year after many people assumed that the presidential election would go the other direction and we would need to be working together to think about how to preserve and strengthen the law. But after the election, those private conversations frankly stopped, and even moderate Republicans were beating the drum of repeal and replace. Well, I had thought last Friday that that drum went silent, at least for now, after Speaker Ryan pulled the bill from the floor. After all, every modern federal program affecting public well-being, from Social Security to Medicare, has required changes and improvements in its implementation, and the American public has experienced the realities of every single one of these programs. So as a result, all of the programs, Medicare, everything, have been improved by years of really hunkering down and trying to work to achieve their purposes. So to make that happen with the ACA, we need a combination of political courage, productive engagement, and frankly, mutual goodwill that's been missing so far. Now, I said I thought the drumbeat had ended last Friday. I'm now concerned in the last few days since the GOP bill failed, there have been at best mixed signals coming from the White House and from the congressional leadership. Just after Speaker Ryan pulled the bill, President Trump made ominous comments to the media and on Twitter about just letting the system explode, which frankly raised legitimate concerns that the administration will find ways to undermine the system. And this was just after he took time last week to actually meet at the White House with one of the ACA's original authors. In the meantime, though, while the president was saying this, his chief of staff, Reince Priebus, has said the White House is willing to work with Democrats on these issues. And others in the administration noted that the executive branch has the means to make the changes through regulations to roll back some of the gains made under the ACA, that would require no input from Congress whatsoever. And frankly, I served for some years on the Energy and Commerce Committee with Tom Price and believe he fully will be committed to looking at some of those changes he can make. So at the same time, we see these mixed signals coming from the White House. On Capitol Hill this week, we see a continued willingness of moderates on both sides of the aisle to try to work together to address parts of the healthcare system where we have shared concerns. Now, even in these hyper-partisan times, this is not unprecedented. As you heard from Allison, I was the chief author, Democratic author, of the 21st Century Cures Act, along with Congressman Fred Upton, Republican from Michigan. This bill was a very large bill which restructured the way we do biomedical research in this country, providing avenues for cures for some of the toughest diseases that face us: Alzheimer's, Parkinson's, cancer, diabetes, and so many more. And in addition, as you heard, this bill has a substantial amount of money for Vice President Biden's Cancer Moonshot Initiative, for opioid treatment and prevention at the state level, and to fund the precision medicine and brain initiatives at the NIH. Throughout the entire process of researching and writing this landmark legislation, Fred and I were unified behind one goal, which is how to modernize the way that we discover, develop, and deliver groundbreaking treatments to patients. Here's what we did that's so pathetically radical in Congress today. We actually started by listening to stakeholders, and we consulted widely with people who knew these problems firsthand. We built coalitions, we had hearings, we listened to people say what would really work as we restructured biomedical research. We didn't always agree on everything, but we tried to work hard to resolve our significant differences, and where we couldn't, we put some of those aside for debate for another day. And the reason we did this is because disease doesn't just strike Democrats or Republicans, it strikes everybody. And we really felt like we had a mission to find the greater good for the American people. As Lamar Alexander said when the bill was signed into law, quote, "The next administration or the next Congress will not be repealing the Cures Act because we have taken out the time to work out our differences and build a consensus of support." And in fact, we passed the bill in the end in the House 392 to 26 and in the Senate 92 to 4. This was not easy to get to this number, but we were able to do it. So in a similar spirit, at this time, Democrats and Republicans can and should work together on policy solutions with the shared concern about our healthcare system. We need to figure out the issues and principles on which we agree, especially in the individual and small group market. For example, most everybody agrees in this country that we need better coverage at a lower cost. But to do that will take a solid understanding of how insurance markets work by pooling risk and incentivizing healthy people to take part. You can't get something for nothing. Insurance products don't simply come in an a la carte form where you can just check off what you want. So there's a number of shared goals that Democrats believe we can work with Republicans on. We can work on reducing premiums. We can work on reducing deductibles and out-of-pocket costs. We can create conditions that favor competition among health care plans in every sector of the market. We can bring down prescription drug prices and many more. Now, this sounds simple, but all of these issues are highly technical. Addressing them will require consulting regularly and upfront with experts who can guide us to policies that will create more stability in the marketplace without eliminating vital consumer protections. And it's going to take thoughtful bipartisan discussion that might take longer than some people want. But that's how you get good legislation that actually works when you're dealing with complex issues. For this effort to succeed, and this goes back to what the president said about the healthcare system exploding. For this effort to succeed, the administration needs to overtly avoid any further actions, whether intentional or not, that would sabotage the ACA. First of all, we need to stop this loose talk of the system imploding or exploding. It creates uncertainty in the markets, even though it's patently untrue. Even Standard & Poor's said that the exchanges are stable, and it's easy enough to disprove thanks to continued high enrollment in the exchanges. Earlier this month, in fact, the Congressional Budget Office confirmed that the market for individuals to buy health insurance policies would, quote, probably be stable in most areas under current law. The next thing that has to happen is the Republicans need to drop their lawsuit seeking to stop the cost-sharing reductions that ease the burden of deductibles for lower-income Americans. Pending an appeal, these cost-sharing payments continue. But if they were to end, most insurers would abandon the individual market. The president has in his hands, solely in his hands, the choice of whether the premiums people pay will be 25 to 35% higher. And he can order this lawsuit withdrawn right now, and he can avoid that from happening. Republicans have promised repeatedly, as part of their claims, that they're going to make deductibles more affordable. Abandoning cost-sharing payments would have just the opposite effect. We also need, frankly, to get some clarity about the vaguely worded executive order on implementing the ACA that the president signed on his first night in office. It left insurers bewildered and uncertain about how to make long-term plans for pricing and other decisions. In fact, a lot of analysts compared it to a bomb thrown into the insurance markets. As time ticks down this spring for insurers to determine their participation in the marketplace, further steps along those lines could threaten the stability of the markets and provoke a crisis. And the administration should promise not to take steps that would depress participation in the next enrollment season for the ACA. This was a mystery to me why they did this. Don't halt advertising for healthcare.gov as it was done in late January. Don't shorten the open enrollment period as the president has suggested, because it would deter just the people we want from enrolling, the younger, healthier people, and it would diminish their access to quality, affordable coverage. After 7 years of noisy partisan wrangling, I can confidently stand here today and say there is a path going forward to strengthen our health care system. There are reasonable, effective solutions that can secure bipartisan support and help us fulfill the duties that we as elected officials have to our constituents and to all Americans. And I think, based on the achievement of 21st Century Cures last year, that bipartisanship really is still possible in our government, and I think that's what the American public wants. Our constituents have been so persuasive and persistent because they want to see us work together to truly make their insurance more affordable and to make health care more available to them. And that's why we should seize this moment in a bipartisan way and do what's best.